A person experiences an ischemic stroke when a blood clot travels into the brain and blocks a blood vessel. This can cause symptoms such as weakness, paralysis, loss of speech, or dizziness. To restore blood flow to the brain, the physician may use a retrieval device such as the Trevo Retriever, a stent retriever that may reduce disability in patients experiencing ischemic stroke. The minimally invasive clot retrieval procedure begins by gaining access to the large artery in the groin, called the femoral artery. From the groin, the physician navigates a balloon guide catheter into an artery in the brain called the internal carotid artery. The balloon guide catheter helps control blood flow to the brain during the retrieval procedure. With the aid of a guide wire, the microcatheter is advanced through the occlusion and positioned distal to the clot. The guide wire is then removed, and the Trevo Retriever is advanced through the microcatheter. A catalyst distal access catheter may be advanced over the microcatheter and positioned just proximal to the clot. Unsheath the distal tip of the retriever. Gentle forward pressure is then applied to the wire, while keeping the microcatheter stable until the retriever's clot capture zone is optimally positioned in the clot. This forward pressure enhances stent expansion to improve clot integration. The device is fully visible under fluoroscopy. The physician may notice a waste or indent in the struts where the clot is positioned. After deployment, visualize expansion of the stent into the clot, allowing time for clot integration. Prior to retrieval, the balloon guide catheter is inflated to control proximal flow. The microcatheter may be removed to allow for a larger channel for aspiration. Connect the aspiration tubing to the access catalyst distal access catheter. Open the tubing clamp to initiate aspiration. Once blood is seen through the tubing, advance the access catalyst distal access catheter towards the clot to ingest and control the proximal face of the clot. Observe flow stasis through the aspiration tubing to ensure clot engagement. The retriever and distal access catheter are then pulled together as a unit while aspirating through the access catalyst distal access catheter and balloon guide catheter. The balloon guide catheter is cleared with a syringe prior to confirming that the blood clot has been removed and blood flow has been restored.